The quality of healthcare in New Brunswick has changed for the better with the health reform that occurred a few years ago. One of the things that was necessary was to gut the bureaucracy that was choking off good patient health care. Nous étions à un moment donné à un déficit de 47 millions de dollars dans toutes les régies de la province. Après seulement toute une année fiscale, nous avons eu un surplus de 4 millions de dollars. We had a $4 million surplus after 1 year after a $47 million deficit. Now, what I do believe we need to have to ensure that standard protocol and good care across the province is had is to use allied health care, is to ensure that everyone knows that there's health care there that may be given to you by a pharmacist or by a small community health center that doesn't have a doctor, could be a nurse or a nurse practitioner, and that we also have a patient bill of rights. A patient bill of rights that has teeth in it so that we force ourselves to rise to the occasion. But there are so many things now that we can do now that we have a system in place where they're working together. We are able to have a provincial registry on surgery that we have not yet put there, but it should be there. All the mechanisms are there. So that you can be on a wait list for surgery in your home region, or you can be on the provincial wait list, and you may end up going over to Perth Andover or down to Moncton a few weeks later. There's a lot of things that can be done when we cut back on the fat in government and in healthcare. And I can assure you in healthcare, there's still a lot of fat there if you have the opportunity ever to go to the book of programs and have those released. We need to have, as soon as possible, a catastrophic drug program. There are people out there that, when I was the Minister of Health, I would say, you know, it's crazy that the Canada Health Act will allow me to give you $100,000 or $200,000 or $300,000 worth of surgery, but if all you need is a pill and it costs $10,000 every 3 months, you're on your own. What I have recently proposed is that we would have, as soon as the new leaders elected, that we would start proposing an interim catastrophic health program so that that would be in place, push the government as soon as possible for the full one in the spring. And that can be paid for by a variety of ways, and I can assure you when the public sees the fat there, they'll find the money. When I was the Minister of Health in 2009, we had an actuarial study done to find out what a catastrophic drug program would cost, and it was $20 million for the Volkswagen, $60 million for the Cadillac. We need to aim for something in between, but we cannot throw those people out in the street, essentially, like the Americans do, simply because they need medications. How we can also ensure that we have better health care around the province is by utilizing, as I said, allied health care. Here's a simple example. My mother and father, in the last few months of their lives, were over-medicated. We went to the pharmacist, and the pharmacist reduced the prescriptions from 10 down to 3 or 4 for each one. They weren't over-medicated, and they were cognitive again, and things went well. We need to ensure that Medicare pays at least once or twice a year for senior citizens to have their medications reviewed to ensure that they're getting the right medications at the right time. The reality is that we do have a good healthcare system. Nous avons un bon système. Nous avons l'accès au système de soins de santé dans les 2 langues officielles. We have good access in both official languages. We have one healthcare system. It's all we can afford, and we need to protect it. Thank you.
This is a perfect example of how doing what's right can not only ensure better services, but can save us money. Having 2 wings of the hospital serving as nursing beds makes no sense. A, it doesn't make sense economically. It costs more money because it's putting more stress on our acute care. Second, it's not offering good services to the people. I'm sure the people at the hospital are doing a good job, but at the end of the day, if the people that are in the hospital that should be in a nursing home, while in a nursing home would have programming, proper visiting hours, their families would be able to visit more often, be able to volunteer and help. They have people on staff there trained specifically to make sure that their lives are comfortable. Alors, ceci c'est un exemple parfait pourquoi c'est important de faire ce qui est bien pour les Néo-Brunswickois, non seulement pour avoir des bons services, mais aussi pour faire certain qu'on sauve de l'argent. And if you look, we have to have these nursing beds, we have to increase the amount, but it has to be in all regions as well. And if you look, using the example that I talked about a while ago, there was an independent report done during the last Liberal government, and this independent report came out with nursing homes that had to be repaired or replaced, and on the top of that list was the one here in the Miramichi. And then government changed colors, and we have a Liberal MLA who's working extremely hard in Farrington to keep this current government accountable, and they took that nursing home away. Well, I can tell you, I've heard that story across this province. Old-time politics, where you can say one thing in one region and do another in another, are done. I've heard about this in St. John, I've heard about this in Dalhousie, I've heard about this in Edmundston, I've heard about this back home. People talking and saying it's not right that my cousin, that my grandfather, that my old neighbor is in the Miramichi in a nursing home that isn't equipped to help them. So we can increase the number of nursing beds by making sure that we become more innovative in our healthcare system. The ideas are there, et ça retourne à ce que je disais tantôt, qu'il faut absolument commencer à écouter des gens qui sont dans les industries. People like Dr. Sanjay and Dr. Lozier, who fight tirelessly for the hospital here in the Miramichi, can tell you how to save money in the hospitals. Instead of going and cutting 8 registered nurses, talk to them and spend a day with them going around the hospital to find out where there are some efficiencies that can be improved. Et il y a d'autres façons de délivrer, disons, la santé primaire, si on voulait aussi. There's an idea out there of family centers, making sure that we're increasing the role of pharmacists, nurses, dietitians, many other healthcare providers, to have 24/7 centers where people can go and access good healthcare. And why is this important? 93% of New Brunswickers have a family doctor. Only 30% can actually see their family doctor, their family physician, within 2 days. So what happens when they can't see their family physician? They go back to the ER, and we continue the cycle where we put more stress on acute care. There are other things we can do. We need a prescription monitoring program. This is going to deliver better services, but on top of that, it's going to save us money. 20% of seniors are overprescribed, misprescribed, or underprescribed. With a prescription monitoring program, we can make sure that stops. If we go and we have a catastrophic drug program, not only is it going to be the right thing to do in the long term, these social benefits will spin off into economic benefits. And we have to be more proactive about our health care. We have to teach healthy living habits. We have to make sure we have preventative care. We have to make sure that we have chronic disease management. Again, perfect examples of offering better services, better care, and saving money in the long term. Again, instead of focusing on changing the governance model, we should be focusing on making sure we deliver proper health care for all. Merci.
Which region we live in. Now, I look at it from a provincial perspective, and I say we are an exceptionally fortunate people that we have the kind of health care that we already have, regardless of where we have to go for that health care. We have to recognize that we can't have all of the services necessarily in our own backyards. When we compare our jurisdiction with that of much less fortunate countries, we say, maybe we're quibbling about things that we don't necessarily need to be quibbling about. And I'll tell you, just as an example, in 1992, I lost my father to cancer. And prior to his death, he required dialysis 3 times a week. And it meant, and I went with him every trip, my mother and myself, and usually one other person, 3 times a week. We traveled the mountain, and we traveled back for dialysis. We never questioned whether we could get it any closer to home. We just thought it was such a good thing that he was able to get that kind of care. Ultimately, in the end, he lost his life, but it wasn't because of the healthcare system, and it wasn't because of where he had to travel to receive that kind of care. I said right from day one that I have as an end objective, and this might come across as a little unusual, but I have as an end objective to ultimately spend less on healthcare. And how do we achieve spending less on healthcare? Well, I think there are a couple of opportunities that are at our disposal. If we implement measures such that we keep people healthier right from the get-go, it will automatically put a lot less stress on our healthcare. So when we were talking about education-wise, and I apologize, I ran out of time. One of the things that's been cut back in schools as well are the physical education programs. And what a disaster that was. But you know, we know the instances of obesity today are certainly more significant than they were a generation ago. And why is that? Well, we've let some of those important practices slip away. And I think we need to get back to some of those basics and say, we're going to start fixing healthcare in our educational institutions. There are a couple of other points. When it comes to delivery of healthcare, I think it's important that we all have access to good primary healthcare in our own communities. And if we can get basic treatment, and ultimately it means that we have fewer referrals to hospitals, less hospitalization, I think that's a win-win situation for all of us. A couple of other points. It's been suggested, and I've heard it from doctors all over the province, that we can save an awful lot of money without affecting frontline services. Well, ultimately, that's what healthcare is all about: the treatment and frontline services. We, the patient, really don't care, or probably shouldn't, what the process is to get us better. We just want to make sure that we get better, and as long as frontline services aren't compromised, we can achieve that. It was mentioned previously also that the need for a catastrophic drug program. I don't care if you live in St. John or if you live in Baldoon. If you are a potential client or potentially in need of catastrophic drug coverage, then absolutely it needs to be a priority of the province. And finally, I'm a big fan of considering the option of private healthcare clinics as well, that still operate under the auspices of Medicare, but are operated on a private basis by healthcare professionals. Thank you.